We're about to go through some massage and acupressure techniques. Now, massage can be used in a variety of ways, particularly at helping to relax the body either during or between contractions, but also to input distracting sensations to help with pain and allow labor to keep progressing. Acupressure points are a little bit different. They are targeted points throughout the body used in Chinese medicine, used for all different reasons, but the ones we're going to focus on are for pain relief and to help labor keep progressing. Stroking massage can be used in between contractions or even during contractions to help create nice relaxing or distracting sensations. And you can just gently flow your hands down through the back and across into the upper thigh. You can also change and add movements to them depending what your birth partner might enjoy. And you can add in sweeps down through the arms as well if they particularly like that. Scalp massage is best used between contractions, and it's been shown to help release oxytocin, so helping to stimulate and progress that labor process. So you can do it in any way that feels best for your birth partner. You might come behind and go into the back of the scalp and just gently massage through the hair. And it might be easiest if their hair's down in this situation. You might just be able to kind of flow over and across their hair. And again, it's very independent for what they might enjoy. So firm pelvic pressure on the sides of the sacrum and the pelvis is really good during a contraction, particularly if they're feeling the pain really low down into their spine. So you're going to find the top of the hip bones on both sides and then place the heel or the palm of your hand into the space just below the top of the pelvis. You're going to create a firm pressure inwards, squeezing both sides of the pelvis together and trying to sustain that throughout the whole contraction. Now you can change the angle depending on what they prefer. They might prefer one that's a little bit lower inside the hips or a little bit firmer pressure up through the sides of the pelvis. Kneading massage techniques can be used if there's a particular muscle that's causing discomfort or pain. It's most commonly going to be in our upper trap muscles up here, and you're just wanting to grasp or gently pinch the muscle, and you might just roll your fingers back and forth to create a gentle massage. You can do it anywhere throughout the body. It might be in different parts of their legs. You could do the same thing through the hips, firm pressure, and rotate through the hands as well. Acupressure are points used throughout the body in Chinese medicine that are linked to different body functions. And we're going to use 3 of our most common acupressure points to help alleviate pain, again during or in between contractions. And the first one we're going to do here is large intestine 4, and it sits between the thumb and the index finger on either hand. You want to make sure you go deep enough that you're into the muscle present here, not on the edge of where the skin is sitting. And you're going to apply firm to moderate pressure into their comfort levels. Now, unlike the other techniques, this one can only be done from 40 weeks onwards or during active labor, just because in Chinese medicine they do think it might stimulate the process too quickly. Now, this is bladder 32, so you want to find the little dimples in the lower back. So if you follow the tops of the pelvis down into the sacrum, you'll find 2 little points where there's little divots in the spine. And I like to use my fists in here, and you're going to apply firm, deep pressure into the sacrum. Now note, the person that you're doing this to needs to be supported because they're going to have to work against your pressure here. Again, it's not worrisome if your hands are slightly off position. They will tell you what they prefer and what pressure that they're going to like as well. For spleen 6, you need to be able to get close to the ankle bone, and this point can be used again during or in between contractions, and it can be also used if they're having an epidural to help continue and progress labor. So you're going to find the inner part of the ankle, and 3 fingers width above the bony point of the ankle, you're going to place a firm amount of pressure just behind the bone, in between the bone and the calf muscle. So firm to moderate pressure here, and it's sustained for how long they would like it to be.